American Diabetes Association actually finally got back and they agreed to an interview. Preparing for their American Diabetes Association interview, I took a look at their diabetes diet and meal plan recommendations, and they were loaded with foods associated with causing diabetes. How could they expect people not to get diabetes if this was the food they were recommending? And then I saw multiple peer-reviewed studies published on the National Institute of Health website showing that a low-fat, plant-based diet was more than twice as powerful at controlling and even reversing diabetes than the ADA recommended diet that included meat and dairy.
Well, the mission of the American Diabetes Association is to identify a prevention and a cure for diabetes, but in the meantime, to improve the lives of all people who are affected by diabetes.
And what's the best way to prevent this?
For type 2 diabetes, it's unclear. We can't prevent type 2 diabetes in everybody.
When we're doing the research, we came across a lot of studies that said that you actually could potentially cure or reverse diabetes with a purely plant-based diet.
I don't believe there's sufficient evidence to demonstrate that.
How does it compare to the ADA diet that you recommend?
We don't recommend a specific diet. We recommend healthy eating.
The one that's on the website.
We recommend healthy eating.
Do you have a whole list of exact day-to-day, the meal plan, the whole meal plan?
All they are selections of foods to consider. We do not have a diabetes diet.
But with that selections, that you consider that plan compared to a plant-based plan?
No one's done that study.
We found actually some studies, that a 74-week study found that low-fat vegan diet versus the ADA plan in type 2
I
diabetes.
think we're done here. I'm not gonna get into an argument about.
Oh no, I was just wondering the studies of if this is true or if it shows that. Or
Any diet works. Any diet works if people follow it.
But if it's a diet that's not the proper diet, like if anyone follows a diet that they eat
I can't tell you what a proper diet is. I can tell you what an improper diet is.
So then we can talk about the good diets. I'm not sure why.
I'm not going to get into that.
Into diet?
No.
Why not?
If that's where you want to go with this, I'm sorry, I'm not the person that you should be talking to.
And why is that though?
If that's what you want to get into, I'm not the person you need to be talking to.
Who do we talk to about diet?
You can talk to anybody you want.
But that's interesting though. Why not recommend a diet?
Because the data don't exist to support it.
But if we see data that we looked up that supports it with, like, the NIH, in Europe, the European Association of Studies.
We're done. I'm sorry. I'm not going to get into that argument with you.
No, it's not an argument.
I'm not going to get into the argument.
Why is it an argument? It's just talking about in European study of diabetes and other places that have studies. Why?
There are lots of studies.
Why is it even an argument?
There are lots of studies in the literature, many of which have never been replicated or, frankly, are wrong. That's why we do peer review, okay?
The European Association of Study of Diabetes has been peer reviewed? Or
I don't know what study you're referring to, and in the absence of being able to see that study, I'm not going to comment.
I could show it to you.
I'm sorry, I don't have the time for that.
I just don't understand why it's an argument, though. Okay. That was interesting. What he wanted to talk about was people living longer with diabetes. But once you mention eliminating diabetes or prevention, oh, whoa, now you cross the line. Prevention and cure, whoa, let's not go there. Not only did Dr. Ratner, the chief medical officer of the American Diabetes Association, not want to talk about diet, but the fact that he had such an emotional reaction to my question made it feel I was digging into something that he didn't want uncovered.